My name is Ed Coyle, and I am the Executive Director of the Alliance for Retired Americans. We are a 4 million member strong organization in the country with 1,500 local chapters, and I'm proud to say that we work very closely with all of the elected officials that you will be hearing from today. I want to thank them, Jan Schakowsky, Doris, Matsui, Lujan, Grisham, and I want to thank Nancy Altman, who joins us from Social Security Works, for being here. On behalf of seniors, we're here to deliver petitions and cards to members of Congress with a clear message. Have a heart. Have a heart. Next week, in lobby visits back home and during the recess, we will continue to deliver that message, have a heart. The Alliance is determined to reach, right now we're going to reach over 70 members of Congress in their districts where it counts the most, and we will be doing that on an annual basis. We have done it on an annual basis over the years. So the Have a Heart on Social Security, Medicare, and Medicaid project is very important to us. People need to have a heart and keep the promises our nation makes to its workers and its retirees. They need to have a heart and keep America a nation where we still lend a helping hand to the young, to the old, and to the sick, and to the poor, and to the disabled. Have a heart and do not try to balance the budget on the backs of America's seniors. Medicare and Medicaid are two of our nation's greatest success stories. They help millions of retirees afford the medical care that they need. They give middle-class workers, they have middle-class workers worrying less about their future. Before Medicare and Medicaid, many seniors could not afford to see a doctor or to fill a prescription. Long-term and nursing home care was simply out of the question for most seniors. The elderly poverty rate is now 75% lower than before Medicare and Medicaid. Today, nearly all over 65 have health coverage. Before Medicare, only half of them did. We have all heard people say that Medicare and Medicaid cost too much money, that we're a nation that just cannot afford that anymore. But it doesn't have to be that way. First, the Affordable Care Act is lowering the cost of health care for seniors through better access to the preventive screenings that law now provides. There is also it's a good law, and we'll have to keep it working. We can continue this progress by finally closing a special interest loophole that keeps Medicare from negotiating volume discounts from the big drug companies. It is absolutely outrageous that these big companies continue to force American taxpayers, fleece them out of their dollars, their hard-earned dollars, on higher prescription drug costs than they need to pay. I was pleased to hear President Obama support this change in his State of the Union address the other night. Congress needs to listen to the voices of today's seniors, the folks that who every day are trying to stay healthy and make ends meet, and who worry every day about their children, and their grandchildren. Today's seniors do not want to be the last generation to retire. They want Medicare, Medicaid, and Social Security to be there for not just them, but for generations to come. It is now my pleasure to introduce a great friend of seniors everywhere and retirees. She's the co-chair of the House Senior Caucus, Congresswoman Doris Matsui from California.
Thank you very much, Ed, and thank you all for being here today. It's welcome to all of you, and with your wonderful hearts, and happy Valentine's Day. I see most of you are in the favorite color of today, too. I'd like to thank the Alliance for Retired Americans and Social Security Works for their tireless efforts on behalf of our nation's seniors. America's seniors and millions of those who are soon to become seniors face many common but very personal challenges, such as managing chronic illnesses, paying their bills, and providing for their families. Despite these challenges, many policymakers continue to consider cuts to Medicare, Medicaid, and Social Security as a valid deficit reduction option. Unfortunately, some proponents of cutting these vital programs are right here in Congress. Time after time, we see proposals that seem to think that the best way to balance the budget is to slash Medicare, Medicaid, and Social Security. This is wrong. Attempts to balance the budget should not come from benefit cuts to America's seniors. Those who work hard and play by the rules deserve the dignified and secure retirement that we have promised them. There is no question that our country faces some big challenges and big decisions in the upcoming year. We must continue to responsibly pay down our nation's deficit, but we must not do so at the expense of our nation's seniors. Benefit cuts are irresponsible and unnecessary, and I would also say immoral. Thanks to the Affordable Care Act, we are already seeing significant cost savings. Not only is this landmark health care law increasing access to health care for seniors, but is also producing tangible savings for our country. In fact, the average cost per senior enrolled in Medicare decreased to an all-time low in 2012, and this will continue as the ACA moves forward to full implementation next year. In addition, the ACA will continue to save billions of dollars by improving quality of care and fighting fraud, waste, and abuse. Clearly, we are already on the road to restricting wasteful spending and cutting our deficit. Any additional savings from Medicare and Medicaid should come from further increasing efficiency, not from shifting costs or cutting benefits to patients and families. Seniors already pay 3 times as much in out-of-pocket expenses for their health care compared to younger individuals. Cutting benefits or requiring seniors to pay more will result in seniors foregoing necessary care. This is unacceptable. Therefore, we should shift the discussion from cutting benefits to strengthening Medicare and Medicaid through improved program integrity and increased enforcement. This is the right direction to take, and it should be pursued before a single dollar is taken from seniors or the benefits they depend upon. So this Valentine's Day, it is critical that all members of Congress on both sides of the aisle consider their family, friends, and loved ones and how they would want them to be treated in their golden years. Let's come together. Let's have a heart and protect Social Security, Medicare, and Medicaid for all of America's seniors. Thank you.
Thank you, Congresswoman. It's now my pleasure to introduce Congresswoman Jan Schakowsky of Illinois. Congresswoman Schakowsky has been doing work with seniors and retirees for a very long time, long before she became a member of Congress, long before she became a member of the state legislature of Illinois. In fact, she was the executive director of the Illinois Council of Senior Citizens, which ultimately became the Illinois Alliance for Retired Americans. So we have a very special place for her in our heart and the work that she does. So please welcome Jan Schakowsky.
Thank you so much, Ed Coyle from the Alliance for Retired Americans. I want to thank Nancy Altman from Social Security Works and my colleagues for being here today on this wonderful Valentine's Day and holding this press conference on behalf of seniors and people with disabilities and families who rely on Social Security, Medicare, and Medicaid. You've heard the numbers that underscore the importance of these national treasures, but I want to talk to you about one of my constituents, a woman named Ms. Levin from Chicago. Ms. Levin was one of several constituents Smith called when we first faced the showdown over the debt ceiling, the manufactured crisis caused by the Republicans insisting that they would not meet American fiscal obligations without forcing budget cuts. Ms. Levin lives on her Social Security benefits. It's her only income, and that's true for 90%, for 33% of Americans who rely on Social Security benefits for 90% or more of their income. And she was terrified that she would not get her next check. She told me that her Social Security benefit didn't last through the month. She was already skipping meals. One of the results of that showdown is sequestration. And now we are faced with another manufactured budget crisis and more demands for cuts in modest Social Security and Medicare and Medicaid benefits. As my colleague Doris Matsui has said, we must not attempt to reduce the federal budget by creating more budget problems for people like Ms. Levin. The chained CPI, one of the issues that's now on the table, which would lower the cost of living adjustment for current beneficiaries and future beneficiaries alike, is a benefit cut. The chained CPI is not a more accurate reflection of the inflation measure for seniors. It doesn't reflect their higher and more fixed costs, especially healthcare spending, but it would create real pain for beneficiaries, especially older women. But it is also important to understand that the chained CPI is just one proposal. Combined with increases in Medicare cost-sharing requirements and the potential loss of long-term care services in Medicaid, the result would be a double or even a triple whammy. A larger share of a smaller Social Security check would have to go to health care, leaving seniors with less for the rest of their daily needs. And let me point out that the share of the average Social Security benefit now spent on Medicare premiums and cost sharing has already risen from 7% in 1980 to actually 26% in 2010. We do not have to ask people like Ms. Levin to tighten their belts, even more than they already have. There are plenty of other options available to us. We can scrap the FICA wage tax, that amount of money that we pay into Social Security if we're working people, that ends at about $110,000. After that, not a penny goes into Social Security. We can lower health care spending, and I've introduced a public option bill that would save $108 billion over 10 years, and call it my Public Option Deficit Reduction Act. We can require prescription drug negotiation and save over $200 billion. We can ask the top 1% of highly profitable corporations and individuals and companies that outsource jobs to contribute more, not demand that seniors whose median income is $22,000 a year to live with less. So I am very proud to join with my colleagues and with the Alliance for Retired Americans and Social Security Works and the Strengthened Social Security Coalition, lots of groups around the country, in opposing the chain CPI and other cuts to Social Security, Medicare, and Medicaid benefits. Thank you.
Thank you, Jan. Our next speaker is a freshman member of the House, Michelle Lujan Grisham. We are very happy to have Congresswoman Grisham join us in the House of Representatives because she has been a long-time leader on retiree senior issues in her native state of New Mexico, where she also became the first Secretary of Aging and was served in that capacity before she became a member of Congress. So we know that she's going to become, in the tradition of Jan Schakowsky and Doris Matsui. We look forward to working with her for a very long time. So Congresswoman, it's my pleasure to introduce you.
Thank you very much. Good afternoon. What an honor on Valentine's Day to join these wonderful individuals and colleagues to do what we all should be doing, is working hard to continue to be champions and to protect society's most vulnerable populations and families. And I joined Congresswoman Schakowsky in telling you a story about a constituent of mine in Albuquerque, New Mexico, who is really close to me because she lives with me and is my mother. I talk about her often because I'm living every day, as she is, trying to mitigate the risks that these retired populations have every single day. And the value and the importance of all of these programs collectively. Social Security income annually is less than $16,000 a year. That's too high, by the way, in the state of New Mexico to automatically qualify for Medicaid, which is a broader program. So I'm going to talk about the value of Medicaid and that it provides for those long-term care needs for individuals who can't bathe themselves, dress themselves, feed themselves for a variety of physical or cognitive reasons, and that population in this country is escalating, and yet we aren't really investing if we allow the Republican agenda to begin to reduce and cut these programs and make eligibility even harder. And then families like mine
I can't afford to pay those copays and those direct costs. And I will keep my mom, if we have a partnership, healthier, longer, so that she's the example about not spending money in Medicaid. But we don't get that chance if we allow Medicaid to be block granted to the states. And in a state like New Mexico, that would be a 50% reduction. Now, the average beneficiary in my state, who's getting home and community-based services, who's treated with dignity and respect, who's kept out of a nursing home, who's kept out of a hospital, which are the nation's highest cost centers in these programs, highest cost centers, is little more than $13,000 a year, as compared to the average cost in the country for nursing home care, which is $78,000 annually. So in an environment where we are all dedicated to making sure that our programs are efficient and cost-effective, that they grow productively to support these vulnerable populations, we are now talking about doing the very opposite of the Affordable Care Act, which is expanding Medicaid so that we're getting in early, we're keeping people healthier longer, we're supporting families, we're making sure that these vulnerable populations are protected from abuse, neglect, and exploitation. We are now suggesting that we will give states less money, but spend more per person on the very things that our constituents are asking us to resolve. So I suggest today that this partnership between these programs is a family benefit, that families should be fighting for equity here, that that's exactly why Medicaid was not part of the Balanced Budget Act. It should not be on the table now. We should not be talking about eligibility and benefits. You squeeze it here, as I illustrated, it just pushes out someplace else. What we should be doing is looking for the measures that you've heard by my colleagues, including prescription drug negotiations, but also that we change the delivery system so it's meaningful, it's fair, it's equitable, it's accessible, and it focuses on keeping families together and keeping us healthier longer. I beseech Congress to continue to think about our families, our seniors and disabled adults, and make sure that these lifeline programs, which keep hospitals open, doctors in your communities, and people in their own homes for as long as possible, complete, whole, and completely protected. Thank you very much.
Thank you very much. Finally, and then we'll take questions from the press if there are any questions from the press. I'm about to introduce Nancy Altman, who tells me she's a 35-year veteran of Social Security. I think she must have started when she was 4 years old. At any rate, she's the co-director of Social Security Works, a broad coalition of a lot of organizations that have grave concerns about keeping Social Security where it is today and providing those services for people in the future. The Alliance for Retired Americans works very closely with them and is part of her coalition, so it is my honor to have her come up and say a few words.
And thank you for that Valentine's Day gift. And thank you for all the work the Alliance has done in protecting these programs. And a special thank you to the three members who just spoke. They definitely have a heart for these programs, as do the American people. The American people are united in their view of Social Security, Medicare, and Medicaid. They do not want Social Security to be discussed as part of a deficit deal, and for very good reason. Social Security has its own dedicated revenue. It has no borrowing authority, and indeed owes no money to anyone. As a consequence, it does not add a single penny to the nation's debt. Furthermore, the overwhelming majority of Americans do not want Social Security benefits reduced. Again, for very good reason. Social Security's benefits are modest by any measure one wants to use, yet they are vital, providing 2/3 of seniors with most of their income, not to mention the vital role they play in replacing family income when workers find themselves seriously and permanently disabled, or when workers die leaving small children. And we should be clear, as Representative Schakowsky said, adjusting those modest benefits so that they do not erode over time as a result of inflation are a basic part of the program's protection. The current index undermeasures inflation for seniors and people with disabilities. The so-called chain CPI is even less accurate. It is plain and simple, a benefit cut disguised to look like a technical change. In light of a looming retirement income crisis, where more and more workers will find themselves unable to maintain their standards of living in old age, we should be discussing increasing Social Security's modest but vital benefits. As a nation, we certainly can afford that. It makes no policy sense to reduce its benefits. Policymakers who vote for cutting Social Security would be engaged in poor policy and would be disregarding the will of the people they have been elected to serve. And let me make one more final point quickly. Social Security is of no value if people cannot access the benefits they've earned. The costs to administer the program come from this dedicated revenue, which, as I said at the outset, has nothing to do with the government's deficit or debt. And the administrative costs are extremely low. They are much lower than you can find in any private sector counterpart. Yet at a time when our population is aging, the Social Security Administration has been starved of necessary resources. Sequestration would make this even worse. Many talk about running the government like a business. Businesses that serve the public spend what is necessary to provide the best service to their customers that they can. And policymakers should allow the Social Security Administration to do the same. Thank you.
Thank you, Nancy. Is there any member of the press that has a question for any of the speakers today? Yes.
Congressman Schakowsky had said the other day, like, the White House is still open to the chain CPI. Have you had any conversations with them, or are you confident that, once the time really comes around?
I have had conversations with the White House. We are providing them with information. Well over a year ago, when there was talk about raising the age of Medicare, for example, we had conversations, provided some of the facts about what the outcome would be, both for the economy and for beneficiaries, and it was taken off the table. My hope is that through these conversations and through this information, that we could do the same with the chain CPI. I think if these things are looked at in isolation, what we're getting back is that it's just a little cut. But you start combining those little cuts with more cost sharing under Medicare, with cuts in Medicaid, and those, and suddenly the Social Security check is significantly diminished. So we want to talk about, we are sending them information about those combined effects, all of which they actually, at least the Medicare or cost sharing, are on the table. And we're hoping that they'll make the right decision.
Any other member of the press want to ask a question? Okay, then let me again thank our speakers for taking time out of a very busy day up on the Hill, and thank all of you for attending. The message here is clear: have a heart. Make sure that you tell members of Congress and the Senate today to have a heart. Make sure you tell them all next week while they're in their congressional districts to have a heart. In fact, why don't you tell them every day of the year to have a heart, because their grandparents and sisters and brothers and children and grandchildren are all hoping they do. So thanks very much for coming.